We continue with treatment principles, this time treating manifestation first and the root later. Under certain circumstances, the root becomes secondary and the manifestation needs to be treated first and usually urgently too. This approach is applicable in all cases when the clinical manifestations are very severe or even life-threatening. This is especially common in acute cases. For example, a patient has a productive cough with profuse watery sputum, breathlessness, chilliness, a thick sticky coating, and a slippery pulse. The clinical manifestations reflect spleen yang deficiency, the root, causing retention of phlegm in the lungs, the manifestation. In this case, if the clinical manifestations are severe and acute, particularly in an elderly person, the correct approach is to deal with the manifestation first by resolving phlegm and stimulating the descending of lung qi. Later, when the symptoms of phlegm have subsided, one can treat the root, that is, tonify and warm the spleen. Another example, a woman suffering from dysmenorrhea caused by stasis of blood, itself caused by deficiency of qi. In this case, the correct approach is to concentrate on treating the manifestation, that is, move blood and stop pain, before or during the period, and in treating the root, that is, tonify qi, just after and in between periods. So the strategy of treating the manifestation first and the root later is applied when the former is producing severe and distressing symptoms, which need to be addressed urgently, often in acute cases. Dispelling the pathogen prior to strengthening the vital. This method is applied to the syndromes of excess of pathogenic qi with deficiency of vital qi, where the pathogen should be eliminated urgently, but the vital qi can still withstand the attack. Under this circumstance, pathogen should be eliminated first by purgation, followed by regulation and tonification. For example, consider blood deficiency caused by blood stasis, metorrhagia, and metastasis. If blood stasis continues, metorrhagia and metastasis cannot be stopped, and blood deficiency will worsen. So, blood stasis should be dispelled by invigorating the blood and tonifying the blood afterward. Thank you for your attention.